I think we're ready. So again, welcome everyone this morning to this webinar, which is about the Marketplace Transition Project, which is happening now. We are going to cover the project and some special caveats for Marketplace, as well as just kind of letting you guys know what to expect if you go through the Marketplace application. My name is Amy Coven, and I'm the Stakeholder and Communications Analyst for the Oregon Health Insurance Marketplace. We are a state agency within, or an office of the Oregon Health Authority within the Health Policy and Analytics Division, and we help people find coverage who may not qualify for programs like Oregon Health Plan, Medicare, VA benefits, and so on. We help them find coverage through the Marketplace, more than likely with financial assistance. So this is just a quick timeline of the redeterminations work or renewals work, which is going on right now. This work did start in April, and basically just as a high-level overview, the renewals are starting because since the COVID-19 pandemic began, the state held people on Oregon Health Plan who may not have qualified anymore due to income changes or for other reasons because of what's called the continuous coverage requirement. It was tied to some COVID-19 bills that were passed early in the pandemic. So because of that, largely, nobody has really lost Oregon Health Plan benefits since early 2020. So now that the COVID-19 pandemic is winding down, the state does have an obligation to go through and figure out who still qualifies and can stay on the program and who is losing benefits and needs to look for benefits elsewhere. So starting April 1st is when this process began. And as of now, we have began going through, we're in the, let's see, it's June, so we're in the April, May, June, third month of renewals. And we're going through this in groups, so not everyone is going through all at once. The last set of renewals should begin early next year. And folks do have some time to respond and get their information back if they need to. But some people are found auto eligible for OHP as well. This webinar is not about OHP renewal process, so that's just kind of my high level overview. What we need to know, though, is that we do know that there are people who are no longer going to be eligible for Oregon Health Plan benefits. Those are people who are above the income limit or for various other reasons may not qualify. And so that's where our project comes in. So just as an overview, we do anticipate that approximately 300,000 Oregonians that are currently enrolled in Oregon Health Plan benefits will be found no longer eligible. As I mentioned, that could be due to an income change. It could be due to access to other benefits. There could be a variety of reasons. But what this means for the marketplace is that there's going to be a large influx of people that are newly qualified for qualified health plans through the marketplace. Just to put this into perspective, last year during open enrollment, we had about 146,000 people enroll through the marketplace. So the fact that there's up to 300,000 folks that are potentially no longer eligible for OHP and eligible for marketplace is a pretty big influx. So what that means for us is that we are collaborating, and by we I mean the marketplace, very closely with the Oregon Health Plan team to really implement a migration process that helps people understand what their options are and transition from the Oregon Health Plan to marketplace coverage. We know that this is kind of a jarring transition, going from essentially a state paid medical program to a private insurance where you have to choose from a bunch of different plans and benefits, and then you have premiums and out-of-pocket costs. So we're trying to ease that process as much as we can.
Headphones, but it didn't connect.
Just a reminder, if you don't mind muting yourself, just want to make sure we minimize background noise. Thank you. So just a quick reminder, if you're not familiar with the marketplace, or maybe you've, gotten some training a while ago and don't really do much about it, we just want to make sure everyone knows what the marketplace is. So the marketplace is a one-stop shop where people can compare health plans, networks, insurance companies that are available in Oregon. These are all private insurance companies that are available from big name companies. We'll show you in just a few minutes. So these are all very well-known plans. A lot of people, and by a lot, I mean nearly 80% of Oregonians who enroll through the marketplace qualify for financial assistance. And there's two different types of financial assistance available. There's premium tax credits, which help pay the monthly premium that you pay to have health insurance. And then there's also cost sharing reductions. And cost sharing reductions help reduce the out-of-pocket costs associated with using your health coverage. So think about your deductibles, co-pays, co-insurance, and out-of-pocket maximums. These savings can be pretty substantial, especially for folks who might be just barely over the income limit for Oregon Health Plan benefits. Those folks are going to get some really nice financial assistance options through the marketplace. So, although there is a cost associated with marketplace coverage because it is private insurance, it at least eases that burden a little bit. And then another big reason to go through the marketplace and another reason why we're here is because we do work with local insurance agents, and brokers, and application assisters at community partner organizations all around the state that provide free one-on-one assistance to folks to go through the application process, provide choice counseling, so compare plan options and determine which one might be the best. And then insurance agents can actually make recommendations as well. So we do just want to highlight that folks do not need to go through this process on their own. And we will show you later how you can find someone that specializes in marketplace that can really help. So as I mentioned before, marketplace coverage is private health insurance. So there are a few different insurance companies that offer plans throughout the state. We do have a few companies that offer state coverage all across the state. But regardless of where you live, you're going to have at minimum four health insurance companies to choose from. And each health insurance company offers at very, very bare minimum three health insurance plans. So that means that, and really, to be honest, every health insurance company has more than three plans. So that means that even if you live in areas that have less choice in Oregon, like for example, Lincoln County and Deschutes County, those counties do have a little bit fewer options, but they still have 26 health plans to choose from. The counties that have the most choice have 62 health plans to choose from. And we recognize that it's very overwhelming, especially when switching from Oregon Health Plan, where it's here's your benefits, to switch over to a private plan and try and wade through, 62 health plan options or up to 62 health plan options. So we really want to encourage folks to reach out, get help, and that's what a lot of our messaging really focuses on. Bianca, you have a question. Can you please repeat what premium tax credits are? So premium tax credits are financial assistance that's available only through the marketplace, and they help pay the monthly premium, which is what you pay each month to have health insurance. So they reduce the out-of-pocket costs that folks have to pay each month. So speaking of, thank you for that segue, Bianca. The advanced premium tax credits that are available through the marketplace are pretty impactful. This is some examples just so that you can see how much in financial assistance folks might qualify depending on their income. Premium tax credit eligibility is largely based on your income, where you live, how old you are, because it matters how much your premiums are, um, and how many people are in your household. So the marketplace does use the federal poverty level percentages similar to OHP to determine eligibility. So the higher your income, assuming that you don't have a ton of people in your household, then you typically are going to qualify for less financial assistance. It's all based on what is considered affordable for you, according to, Affordable Care Act rules. So these are some examples of how much in financial assistance people could get around the state. The reason why you see a discrepancy in the amount of financial assistance that folks might receive in the tri-county or more metropolitan areas versus like Union County, which is more rural, is because premiums do tend to be a little bit higher in rural parts of the state. So the premium tax credit eligibility is also a little bit higher to make that more affordable for folks. So now that we know what premium tax credits look like, this is how it translates and applies to the actual premium cost. So these are some examples of how much an individual might pay for their plan premium, assuming that they use the maximum amount of premium tax credits per month that they qualify for. So you'll notice that if someone is just above the Oregon Health Plan income limit, then they are going to qualify for a premium that is quite low. And these are all silver plans, so they're kind of the mid-range, really good quality plans, but pretty balanced between premiums and out-of-pocket costs. We do have also bronze level plans where the premiums can be even lower, but the out-of-pocket costs are a little bit higher. And then for those folks that have more health needs, they might want to enroll in a gold level plan where their premium will be a little bit more, but they might not pay as much out of pocket for their benefits. So let's talk a little bit about the Marketplace Transition Project. Um, Here at the Oregon Health Insurance Marketplace, we are standing up, or we have stood up, I should say, a whole new project. And this is really a great endeavor for us. We're really testing the water with some direct outreach opportunities and things like that that we really haven't done before, at a level that we haven't done before, especially. So the way that the process is working right now is if someone goes through and they are found to be no longer eligible for Oregon Health Plan benefits, all of the enrollees who are found to be no longer eligible are sent over to the marketplace. We actually receive a data file that lists each individual. And what we do is we go through that data file and we determine, who might not qualify for marketplace. So maybe they don't live in Oregon, or maybe they're on Medicare, things like that. Maybe they're getting employer coverage. So we kind of filter out all of the people who might not qualify for marketplace coverage. And then based on the file of folks that we know might qualify, we put each individual through our window shopping tool, which I'll show you here in a little bit. And we get a really good picture of what they might qualify for in terms of financial assistance and what plans are available to them. The way we're doing this is we're using the information that we receive from the Oregon Health Plan. So whatever the most recently reported income is what we're using, as well as household demographic information. We know that it's not perfect, but we're trying our best to give as much information to folks as possible so that they can make an educated decision about what opportunities are available for them, rather than just deciding that they can't do anything and opting out. So, what we're also doing is we're using any network information that we have from the Oregon Health Plan. So, if someone has identified a primary care provider or or a specialist or anything like that, then we will put that information into the window shopping tool to determine if someone can get a plan where their providers are still covered. So we are using as much information as possible. At that point, we're using all of the information that we gather and we're putting it into a letter, which we're sending out to each individual. And that letter basically says, this is how much we think financial assistance you might qualify for. This is your least expensive silver plan that covers your doctor if we have this doctor information available, or the least expensive silver plan that's available. And then the second least expensive plan available as well. So we are trying to tailor that as much as possible. We do want to note that for our tribal members, because of special cost sharing provisions, we are only sending them the least expensive bronze plan. And if you have more questions about special savings for tribal members, please, let us know. We can go over that in a different webinar. So once we send those letters out, we are giving folks a little bit of time to digest the information and explore the options on their own if they want, or seek help from an expert. When approximately 30 to 45 days after our letter is sent, we are receiving information from our federal partners at CMS saying who has not taken action through the marketplace. So we're then comparing that file to the original file that we received and determining Who hasn't taken action yet? And then we're doing even more outreach. We're actually reaching out to people by text message, email, direct phone call, really trying to make sure that folks understand their options and don't have any misconceptions, or at least that we can overcome those misconceptions for them. Once they understand their options, of course, then we hope that the consumer will start the enrollment process. And they can do that either by calling our help center, or getting assistance from an insurance agent or a certified assister, or of course, they can go directly to healthcare.gov for that as well. So, as I mentioned before, we have a number of different communications channels that we are using to directly message to people who are no longer eligible for Oregon Health Plan benefits. The number one goal that we have is to overcome the misconception that marketplace coverage is not affordable, or that it's, well, it is difficult to wade through. So we're trying to help people get through those challenges. So again, our messaging really emphasizes two things: when and how to enroll through the marketplace, and where to find local help. Again, we recognize that the process can be very confusing. So for that reason, we are really emphasizing that folks should seek help from an expert. We're also doing some organic social media campaigns. We've got some printed publications available to help folks who are no longer eligible for OHP understand their options. And then we are planning additional communication strategies as necessary, as this process is implemented and unfolds. So, just as an example, we have 14, I believe, if I'm remembering the right number, 14 different letter variations that are being sent depending on the circumstances for each individual that is referred to us. So what we do is we go through, look at the situation for the individual. We run them through our window shopping tool to determine what their potential financial assistance eligibility might be. And then we give them, as I mentioned before, two plan options for most people. Tribal members are going to get the least expensive plan option because of the special cost sharing provisions that they have available through the Affordable Care Act. And we are sending these notices in the top 14 languages, depending on communication preferences. So if you're interested to see, what languages we have sent notices in, or how many notices we've sent, we have a dashboard on our website, and we do update that daily so you can see, where we're at in the process. Um, I do see the question in the chat. I'm gonna wait for just a minute to answer that, but I promise I will. So I do want to call out that the federal government, CMS, did initiate a new special enrollment period that is available to people specifically who are losing Medicaid or CHIP, or Oregon Health Plan here in Oregon, um, between March 31st of 2023 and July 31st of 2024. So basically, what this special enrollment period allows folks to do is just self-attest that they are losing benefits through the marketplace. So there's a new question that they'll have to answer. I'll show you that in a moment. They'll need to attest that they've lost Medicaid or CHIP coverage between the two dates mentioned. And then they will automatically qualify for this unwinding special enrollment period. Similar to the loss of coverage special enrollment period, people can take action before their Oregon Health Plan benefits actually end. So as soon as they have a date that their Oregon Health Plan benefits are ending, they can go to the marketplace, report that date, and up to 60 days before their benefits end, they can choose a new plan and enroll for coverage to start on the first of the month following the last date of the Oregon Health Plan benefits. The cool thing is, though, with this special enrollment period is that folks do have until July 31st of 2024 to actually take action. Now, we do highly encourage people to take action before their OHP benefits end, because we don't want them to have a gap in coverage and, potentially something happen during that gap and them not having that health coverage. But if someone, didn't see a notice, or for whatever reason didn't take action, they can do so before July 31st of next year. And then their coverage will start on the first of the month after they enroll. So on the marketplace application, there's a couple of new questions that help determine if someone might qualify for this new this new special enrollment period. So the first questions are going to ask specifically if anyone is losing Oregon Health Plan benefits. And then they'll ask if anything has changed since they got that determination. So, for example, if someone got a closure notice, let's say they were told, "Hey, you don't qualify anymore based on the information we have in the system," but maybe they had a recent job change, and so now they do qualify. They can put that information in, and basically what will happen is the marketplace will say, "Oh, well, you were told you don't qualify for OHP, but it looks like something might have changed since you were told that. So let's just make sure you don't qualify." The marketplace is going to do everything they can to make sure that people get into the right program for their eligibility. The next set of questions are going to relate to eligibility of for loss of coverage special enrollment period. So they do still ask the questions about do you have coverage that's ending soon, and so on and so forth. The cool thing is that Marketplace has updated their application so that when you answer the first set of questions about for the unwinding special enrollment period, it will auto-populate the questions in this section. So they don't have to retype it in for a second time. It's all there. But they will want to make sure that the information is populating correctly. All right, so we're going to go through just a few more slides here, and then I'll jump into questions. So thank you for your patience. So just again, some key facts about enrolling in marketplace coverage. So when someone takes action and enrolls through the marketplace, their coverage will always typically begin on the first of the month following their enrollment. So if they are able to enroll before their OHP benefits close, their coverage will begin on the first of the month following the date their OHP benefits close. OHP benefits, in as far as I'm aware, typically do close on the last day of the month. So that should be a pretty seamless transition for folks. It's important to note that marketplace coverage cannot be backdated or started retroactively. So if someone does not take action, for example, before their OHP benefits close, then there is a chance that they will have a gap in coverage. And unfortunately, there's just nothing we're really able to do to mitigate that. So we do want to encourage that folks take action before their benefits close. And then we do want to emphasize that the first month's premium, which is also known as the binder payment, must be paid in order to start coverage. So even if the binder payment is only $1 a month or something, we want to make sure that they do look out for that premium bill because it will be sent through the mail to them directly from their insurance company, and they will want to make sure and pay that on time. It does take a couple of weeks for them to send the information over to the insurance company, get them into the system, and then get that bill out. So it's not something that they're going to be able to do right away. But we do want to make sure that they don't miss the deadline to pay that, because if they do, there's no grace period for that first month's premium payment. Even like I said, if it's only $1, and we want to make sure that people aren't canceled for non-payment. So how can you help anyone that's losing OHP benefits? I want to recognize really quick that we've got a pretty diverse crowd in the in the audience. Excuse me, allergies. So the type of assistance that you're able to provide may vary, but we want to let you know about some helpful tools that we offer that can hopefully help the process. So first of all, we want to make sure that everyone is aware of the financial assistance programs that are available at every not-for-profit hospital and affiliated health clinic or health system around the state. So if someone does not have health coverage, or even honestly, if they do have health coverage, they could still take advantage of this financial assistance program. And it is state mandated. So if you have any questions about what facilities are involved or anything like that, please visit the link on the screen. We want to let you know and make sure that you're aware of the window shopping tool, which I'll show you here in just a moment. We do have it available natively in both English and in Spanish. And this tool is very, very helpful to help folks get a real picture of what they might qualify for. And then the third thing that we want to encourage you to do is offer a referral to a marketplace expert who can help with the application and enrollment process. And we do have a Find Local Help tool. You can see the links here to our tool, both in English and Spanish. And on that tool, you can just put in that someone's looking for help with the marketplace. You can put in their address or zip code, any preferred languages that, if they have a language that they would like help in. And then it will show you all of the assistance that's available. So really encourage you to use that as well. All right, so let's look next at the window shopping tool. So the window shopping tool, again, is available natively in both English and Spanish. It is managed specifically by the Oregon Health Insurance Marketplace. So we're really proud of our tool. We've made some really great enhancements in the last few years. And if you haven't checked it out recently, we encourage you to. Um, the tool does link to the Find Local Help tool. It links to the One system and it links to healthcare.gov, depending on what someone might qualify for. It also links to our new employer coverage tool. So we do have a new tool that does help folks understand if any employer coverage that is offered to them is considered affordable. So that is linked as well. So I'm not gonna play this video in full. I don't know if I'm sorry, I can't see it very well on my screen, so I don't know that it's playing at all. But um, this is what the front page of the window shopping tool looks like. If this was playing, again, I apologize, I don't think it is. Then it would walk you through what the tool looks like. But what I really would encourage you to do is just take a few minutes and kind of test it out. Just put through some scenarios. It only takes a few minutes. You don't have to put any PII necessarily. So we just want to, make sure that folks understand what might be available to them. I do want to note that the letters that we're sending are going to give potential eligibility for financial assistance and plan options for an individual. We do recognize that if people are part of a household and multiple people in the household are going to be shopping, that information may not be entirely accurate. There's just unfortunately not a way for us to send a letter that is specifically, accurate for every person's situation. So we're trying to mitigate that as much as possible. But one of the strategies that we have to do that is to encourage folks to go through the window shopping tool. And I promise I will answer questions. I promise. So if you're an insurance agent or a broker or a community partner, we want to make sure that you know how you can play a role in the work that's being done. You are very critical. You're critical in really all stages of this process, but we want to make sure that you know about the outreach and education opportunities that you have, help spread the word. Our message is pretty loud and clear. If you're not eligible for OHP, come check out your options. We want to make sure that you're offering any plan or choice counseling depending on your role. And application or enrollment assistance. If you are certified to help through the marketplace, whether as an insurance agent or a community partner, you can help with that process. So even if it's something that you um, haven't done before, it might be the time to start kind of diving in, depending on your capacity. All right, so this is my last slide, and then I'll go back to the chat and answer questions. So I just want to leave you all with some contacts for the transition project. We do have a new call center, which is available from 7 a.m. to 6 p.m. Pacific time, Monday through Friday. We also have an email address specifically for this project, so please feel free to use that as well. And if you ever want to know, what's going on with the project or find some resources, you can always go to our website, oregonhealthcare.gov. And on the screen, you can see a couple of red arrows. Those are pointing to where the links are to access the information specifically for this project. And that includes that dashboard that I talked about earlier. So if you want to know how many letters we've sent out or anything like that, feel free to visit that. All right, I'm going to scroll back up here. Let's see. Okay, so the first question, do you have a map or timeline when candidates or folks losing OHP would get these outreach efforts? There's a lot going on, I agree. And we do completely, as the communications person for the marketplace, I completely agree with you. People are going to get overwhelmed and fatigued, and we're doing everything we can to avoid message fatigue. So I appreciate you calling that out. As far as a timeline, basically someone will qualify if they no longer qualify for OHP benefits, they will get a 60-day closure notice. And then our first letter does send out very shortly after that. We do get a file daily of the people who are no longer eligible for OHP benefits. And it's currently taking us just a few days to process that. So I would say within about a week to 2 weeks, they should receive a notice from the marketplace. Now, I do also want to note that the federal marketplace, healthcare.gov, is also sending notices. So they should get a notice from the federal marketplace as well. And then about 30 days, 30 to 45 days later is when we would send that follow-up message. The reason why we're going really heavy in that first 60 days is we want to make sure that anyone who wants to prevent a gap in coverage has the opportunity to do so. So we are trying to message as much as possible before their OHP benefits actually end. Okay, so let's see. Something that I noticed myself was that a doctor I have through OHP is not available through regular insurance like Kaiser, but available through MODA. Would individuals have a way to access this possible challenge before losing OHP? So that's a great question. So on our window shopping tool, you can actually put in, if you have a preferred provider, you can put it in to the window shopping tool. And then when you see the list of results, there will be an option to filter to see only the plans that cover that provider, or you can scroll through the list and you can see, which ones have a little green check mark saying that they're covered. So that is the recommendation that I would make. If there's someone that's not showing as being in network on any plans, but they really want to, or they feel like maybe that's not accurate, then the best thing to do would actually be to go to the health plan themselves. Oh, sorry, someone's got some background noise trying to find the meeting here. But they could go to the plan themselves and check the plan's network information. We do have links on our website to that information, so that folks can search the plan. Sometimes the information does take a little bit to get updated when there's contract changes. So just keep that in mind. You can always give the plan a call as well. And we do have plans through MODA available, I think statewide, if I'm remembering correctly. Okay, so next question. If someone has access to insurance through their employer, but that coverage is limited and expensive, can the person use the marketplace to find coverage instead? That is a excellent question. Thank you. So, um, typically, if someone is eligible for coverage through their employer, as long as that coverage is considered affordable and meets the minimum value standard, then they would not be eligible for financial assistance through the marketplace. They could still go through the marketplace and purchase a plan at full cost, but they wouldn't get any help to pay for that plan. So it may actually be, less affordable than their employer coverage. Now, in some situations, employer coverage is not considered affordable, whether for the individual that works for the employer or for the family members of that individual. And if that's the case, or if they want to see if that's the case, they can go to our website. We've got a really cool tool. It's linked just right on the homepage. It's our employer coverage affordability tool, and they can answer just a few quick questions to see, what they might qualify for. So, or I'm sorry, if their coverage is considered affordable or meets the minimum value standard. So it is kind of a tricky question. I can't give, black and white, but yes, there are some people that can get coverage through an employer, but also can go through the marketplace with financial assistance. Just depends. Okay, so confirming folks would only get 2 outreach attempts from the Oregon Health Insurance Marketplace. So no, that's not entirely accurate because so the first attempt is going to be a letter. If that letter is returned to us through the mail, then they may get a phone call follow-up, because we want to make sure people, that didn't get it through the mail, that they have that opportunity. And then we will be reaching out to them again after about 30 to 45 days if they have not enrolled through the marketplace. It's important to know that we only know if they enrolled through the marketplace. We do not have any way to tell if they enrolled in some other type of coverage. So if someone enrolled through their employer or in some other means, then we don't have that information. So they would still continue to get information from us, but they can let us know, hey, I've got other coverage, so please stop contacting me. Um, and the reason why I say it's not exactly correct is because um, we are doing outreach through a number of different methods. So we're doing outreach by email, by phone call, by text message, and then we're also working with our grantee community partners. If they are listed as a community partner on record for that individual, then that community partner may reach out to them as well on behalf of the marketplace. So there may be more than 2 outreach attempts. It just really depends on what sorts of contact information we have for folks, and so on. And Laura, yes, thank you for that call out. Insurance agents are phenomenal at helping people wade through plan options, really digesting, what are the health needs, what are the doctors that they need help with, or if there's facilities that they want covered or services that they need covered. Insurance agents are really, really good at going through all of that and making a suggestion for which plan would work best. So thank you for that reminder, Laura. I can't shout it from the rooftops enough. Our insurance agents are great. So with that, I think I've answered all of the questions that were in the chat. Does anybody else have any questions that I can answer? I can stick around for a few more minutes here. Tanya, very great question. So we will have the recording will be posted to our transition center website. So if you go to OregonHealthcare.gov, and if you click on one of the two links with the red arrows here, it'll be listed under the partner. There's one that says I am a partner, and that's where it'll be listed. We'll also have it on group site if you're a member of the marketplace group site, if you're an insurance agent or an assister. Any other questions? Kathy, I believe there was a recording for that overview. Um, it would be listed on the overall project website. So I can see if I can get that information and send it out to you. I'm not sure if it's up yet. It usually takes a little bit of time. Thank you, everyone, for joining. I really appreciate you all taking time to be here today and to help Oregonians stay covered, or keep covered, I should say, after losing OHP. So oh, that is such a great question. Thank you for asking, and I'm so sorry that I did not mention. So, if someone is eligible only for COWM benefits, which is emergency only Medicaid, then yes, they can potentially go through the marketplace and very likely get a very good amount of financial assistance. Now, the special caveat there is that the only two groups of folks who cannot shop through the marketplace are people who are undocumented or are people who currently are people who have a DACA status, although that may change later this year. So keep your eyes peeled on our website and group site for updates. But yes, anyone else, if they have CALM, even if they have like an LPR status or lawful permanent resident status of less than 5 years, then they can go through the marketplace and get financial help. So thank you for asking that. So, yes. So the question is if a member has income less than 139%, and should qualify for OHP but does not because of immigration status and age, then can they go through the marketplace and get financial help? And the answer is yes. They could potentially, as long as they are documented, and do not have a DACA status. Although, like I said, that might change later this summer. Any other questions? Everybody's hanging on, waiting for that one last question. I love it. All right, everyone. Well, thank you so much for joining. We'll get this recording up as soon as we possibly can. I really, again, want to thank you for taking time to be here today and helping Oregonians stay covered once they lose their OHP. So if you have any questions, please feel free to reach out to us. We're always happy and ready to help. Have a great day.
Thank you.